Okay, I've provided patient privacy, I've done my hand hygiene.
What?
Okay. Today we're going to do a physical assessment. I'll be checking you from your head down to your toe, all your body systems. Are you going to be okay with moving around in different positions?
Yes.
Okay, and can you tell me your name and date of birth?
Jeffrey Vaughn, 12/13/02.
Okay, and can you tell me what today is?
No, actually, it's Sunday.
Okay, and can you explain to me what I'll be doing, what we'll be doing here today?
A head-to-toe assessment, and I'm gonna move around.
Okay, good. I have all my equipment over here, and we'll start with your head. So I'm going to, can I touch your head? Is that okay?
Yeah.
I'll be inspecting your scalp, and the shape of your head is cephalic. I don't feel any kind of masses or lesions on your scalp. I don't see any kind of pests in your hair. And we'll be checking your eyes. I did the Snellen chart outside of the door before we came in. That assesses cranial nerve number 2. I'm going to shine a light in your eyes. Can you look up here so I can see? Okay. And right now I'm just checking for pupillary dilation and constriction. They both constricted, and there was, when I shine the light into one eye, the other eye would also constrict. That's called convergence. I'm going to test the accommodation. Can you look at that right there, those socks right there? Okay, now focus back on my pen. Okay, and the pupils reacted. They dilated when he was looking away, and then they constricted whenever he was looking back at the pen. Now I'll do the 6 cardinal field gazes. Just follow the end of my pen. Okay, good. Oh. And that tests cranial nerves 3, 4, and 6. I'm going to check palpate the lacrimal apparatus to make sure, is there any pain?
No.
And there's no pain, there's no swelling, there's no discharge or drainage. The conjunctiva is pink, the sclera is white. Okay, and now I'm going to go ahead and I'm going to do his ears. So I'm going to go around his ears and feel his ears for any kind of bumps or anything. I'll check behind them, assess the skin, and it's fine. I'll look inside of them to make sure. Wait, sorry. And everything looks clear. There's no drainage, there's no redness. And they look clear. I have my tuning fork here. We'll do the Weber test, and I'll put the tuning fork on his head. This test for cranial nerve number 8. Can you hear that in both ears?
Yes.
Okay, and now we'll do the Ryan test, where I'll put it on his temporal bone, and tell me when you don't hear it anymore.
I don't hear it.
Okay, now tell me when you don't hear it anymore.
I don't hear it.
Okay, and that tests bone conduction, air conduction. Air conduction is twice as long as bone conduction, which he showed that. Now what we will do, so I'll look at inside of his mouth. His lips look good. They're moist. They're pink. Show me your teeth. Teeth are good. Open your mouth. And his oral mucosa is moist and pink. The tongue is moist pink, normal size. Okay. Now I want you to say ah.
Ah.
The uvula lifted, which tests cranial nerve 9. And Also, his tonsils were of normal size. They had some crypts in them, which is normal. Let me see your teeth again, please. Open big. Okay, I don't see any cavities or anything like that. Now I'm going to test cranial nerve, the hypoglossal nerve. I want you to, whenever you feel this on the side of your tongue, press against it, okay? Press against it, good. Press against it, good. Okay, now we will,
It tastes like that tea.
yeah. Now I'm going to take this paper clip. I've got a dull end and a sharp end. And we're going to test cranial nerve number 5 and the motor, no, not the motor, sorry, the sensory function of cranial number 5, which is your facial feeling. It feels pain and stuff. Okay, but anyways, I want you to close your eyes and you just tell me if you feel dull or sharp, okay?
Okay. Dull. Sharp. Dull. Dull. Sharp. Dull.
Oh, sorry.
Dull. Sharp. Sharp.
Good.
I don't know.
No, it's good. Okay, and then I'm going to test the motor function. Just clench your teeth together. Good. I'm feeling at the temporal masseter muscles right here. And I feel them contract whenever he does his teeth, whenever he clenches his teeth. Okay, sit up straight, please, so I can see you. I'm going to I'm going to look at the lymph nodes now. So right here, you can unclench your teeth.
They're not clenched.
You just have a strong bone structure there. I'll test, there's a pre-auricular here, and then a post-auricular, the submandibular, submental, anterior, deep cervical chain, posterior, deep cervical chain, occipital, and subclavicular. I don't feel them, they're not swollen, so that's good. Okay, now what I'm going to do is, again, test cranial nerve number
Keep going.
10, stop it.
Sorry.
Cranial nerve number, I think it's 9 and 11 or 12, I don't know. I just need you to swallow. Okay, now I'm going to palpate your carotid arteries. I shouldn't be doing that bilaterally. I'm doing one at a time, and I'm feeling for any kind of a thrill or anything like that. I don't feel it. Okay, now I'm gonna need you to, I guess, I'm gonna check your thyroid, and I'm gonna have to do it from behind you, which is posterior. So what I need you to do is just kind of maybe stand up, face the camera, so they can see what I'm doing. Okay, I'm going to palpate. I'll have him just hold his head, go down, look down, and
I saw your friends
the right.
Double chin.
Look down. Are you looking down? Okay. Look over to the right. I don't feel anything. Okay. I don't feel anything abnormal. And now what I will do is I'm going to use the bell of my stethoscope, and I will check his carotid. I'll check his carotid first. Listen for any kind of bruits. So there's 1, 2, 3. Now I'm going to do it on the other side. Then I'm also going to listen to his thyroid for any kind of bruits. I don't hear anything. Also, while I'm up here, we'll check his tracheal position for any kind of tracheal deviation. I'm trying to feel it here.
They can hear you.
Okay, and it feels like it's midline. Alright, now what we will do is move on to, okay, we'll do your arms since you're holding them out. This whole time I am looking and assessing stop it, you're going to get me in trouble. Looking and assessing his skin throughout each system. So, like I said, I don't see any abnormal lesions on his neck, on his ears, on his face. Now we'll do his arms. He does have some hypopigmentation on his upper arm and forearm with some scarring on his elbow. Check the other one. Same thing here, hypopigmentation on his upper arm. I don't see any major scars, any surgical scars, a little lesion there. I'm going to check your pulses. I'm going to check his radial pulses. And they are strong, non-bounding. And I feel a brachial pulse there. And a brachial pulse there. Okay, now let me see your fingers. I'm going to test his capillary refill. And all of them are less than 2 seconds on his right hand. Less than 2 seconds on his left hand. Now we'll move on down to the chest. Sit up, please, straight. Looks like I could start posteriorly. I'll do that. Do you want to stand up? Turn around. Okay, so first what I will do is check. Everything looks symmetrical. I don't see any kind of abnormalities of anything. So I need you to just take a deep breath. Good. Okay. And that also checks the filling of each lung. My thumbs will come apart when they evenly fill. But now I'm just gonna, actually I'm gonna do the front of this. Say 99.
99, 99, 99, 99, 99, 99, 99, 99.
And then I'm going to percuss them. And be hearing a mostly resonant sound throughout the lungs, which I do. And then I will auscultate them. So whenever you feel my stethoscope, just take a deep breath. Good. And I'm not going to go along the spine because the bone, I'm sorry, the bone covers up that sound. Okay. Turn around. You sit down. And same thing with the front of his chest. I don't see any kind of abnormalities as far as one side being bigger than the other or anything like that. Okay, and so what I'm going to do here is also a tactile pharmacist. So whenever you feel my hand, just say 99.
99, 99, 99, 99.
Stand up, please.
99, 99.
And again, we'll percuss. I've had to move around so much doing it. And lift arms. And again, it's mostly resonant sounds over the lungs if we should be hearing. And then I will do breath sounds. I'll start at the apex of each lung. And work my way down. Alright. Now, that's all it wants. And then while I'm here with my stethoscope, I'll listen to his heart sounds. I'm going to do the S1, which is the aortic valve, is going to be to this side of the mid-sternum. So there's S1 and the pulmonix S2. And it is to the left of the mediastinum. And then Erb's point is at the third intercostal space. And then tricuspid is third and fourth. And bicuspid is at the fifth. And it's also the apex of the heart. So if I were to be, I'm sorry, that's the, yeah, That's also where the apical pulse is located. Okay, so let me sit down, please. Now I forgot to check his reflexes when we were up here, so I'll go ahead and do that since I'm about to move down to these reflexes anyways. So, I'm just gonna hard to get on him. I'll support that like that, and this is his tricep reflex. Oh, I did that with the wrong side. I was supposed to do it with the pointed side. Okay. And his brachial. I don't know how to do it while I'm standing up. Okay.
They can't see what you're doing.
Brachioradial. Okay. Good. 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 Okay, I'm gonna go ahead and while I've got this in my hand, I'll do his patellar reflexes. Good. Good. And his Achilles. Stop, I didn't even hit you yet.
Well, they can't see you.
Oh. You can't see him, but I'm gonna hit his Achilles
Shut my
tendon.
30 feet.
I'm doing it.
Go on, I'm doing something.
Sorry, kids are home. Anyways, I'll hit the back of his Achilles right here with the pointed end of the hammer on both,
feet.
and assess for a reflex. And I also did not do the cranial nerve number 1 or check his nose, so we'll go back to that. Close your eyes and tell me what you smell.
Christmas.
It's chai tea. It smells like, I told him it smells like Christmas in a cup, so he's right. So cranial number 1 olfactory nerve is intact. I'm just going to feel your nose here. The skin looks good on it. I don't feel anything abnormal. I'm going to look for, I want you to hold one nostril shut and blow out the other one. You don't have to blow hard, just blow. And do the same on the other. Okay, good. Look up your nose. Okay. It's moist, a little pink like it's supposed to be. No excessive drainage. Okay, and then also I want to check cranial nerve number 8 again, which is the hearing. I want you to cover one ear, and I'm going to say, it doesn't matter which ear you cover. I'm going to say 3 words. I'm going to whisper 3 words into your other ear, and you just repeat them back to me.
Basketball. Airplane. Pizza.
And the other ear?
Hammer. Curtain. Dresser.
Good. Okay. So it's cranial number 8 again. And if I can get you to, where's your pillow?
Don't lose my socks.
Get over. Lay down. I'm going to assess if any distension in the jugular vein. So I can't get them up. It's supposed to be at a 30 to 45 degree angle. Quit because it's not going to work. I need you to turn your head. I don't see any distension. Turn your head to the other side. I don't see any distension on that side. Okay, can I get you set up, please, real quick? Because I forgot to check cranial nerve 11. So if you could shrug your shoulders. Okay, good. Lay that down.
What about the squish your fingers?
Yes. The finger grip. Yes, good.
Sorry.
Okay. Now we'll move on to the abdomen. And here I'm going to start by auscultating bowel sounds. Yeah. The right lower quadrant.
Cold.
Sorry. And then I'll go clockwise, or yeah, that's clockwise. So right lower, right upper, left lower, and I hear normal bowel sounds with him. I would actually keep my stethoscope there for a couple of seconds. And during that, before I started, I inspected. I don't see any abnormal scars. I don't see anything wrong with his skin. There's no abnormal distension, lumps, masses that I can see or anything like that. So now what I will do is, now I will percuss over his abdomen, and it should be most of the abdomen should be a tympanic percussion sound. Around the liver and spleen area, it'll be dull. It'll be more dull, especially if the spleen's enlarged down here under the 9th intercostal space. It'll be really dull. So anyways, and I'll just percuss each quadrant, and then over the liver and over spleen area. I'm going to now, because I percussed, I'm going to palpate. So what I'll do is do each quadrant, and I'm just feeling for any masses or anything like that. I'm going to feel for his aortic artery for any kind of, I don't know what it's called. His aorta. And then I've looked for the peristaltic wave. I didn't see any. And while I'm here, I'll listen to vascular sounds. I'll listen to his aorta, his renals, renal arteries, iliac arteries. Okay. And then over his liver and over his spleen. Okay, and then I've already done the reflexes on his knees and on his Achilles. Guess I can feel for again dorsiflexion. So I need you to push against my hands. Okay, good. Now push against them. Good. Good, good, good. His skin is cool, dry. Okay, hold on, I'm getting there. His skin is cool and dry to the touch, pretty much everywhere. So, I need you to run your heel along your shin. Okay, good. And the other one, heel to shin. Good. I'll check his dorsalis pedis pulses. I can feel that. Stick your big toe up, please. There you go. I'm going to feel that right beside there. Okay, relax. Good. Okay, another one. Okay, relax. Good. Those tibial pulses. Kind of relax your foot outwards. There you go. Good. Okay. Do you want to stand back up?
No.
Okay, stand back up. Now we'll do the Bromberg test. It's also test cranial nerve number 8. I need you to just close your eyes, put your feet together, close your eye, put them straight together. Okay, Miss Cujo says do it with her hands out. So a classmate said no, that's not how you do it, but I'm going to do it how Miss Cujo told us to do it, which is put your hands out. And what this does is it tests to see if they sway or not, which has to do with cranial nerve number 8. He's fine. So you can pass the Bromberg test. Now what I want you to do is start over there. And then I want to see you walk heel to toe to me. Okay, good. Turn around. And just walk normally now. And just assessing his gait. I don't know if I missed anything or not. Did I miss anything?
I don't believe so.
I used all of my tools. And that is my head to toe assessment. Thank you.